started. I'm gonna push record. So welcome everyone. This is just an opportunity to check in about the System of Care advisory grants and other opportunities that we're offering to Oregon's 9 federally recognized tribes. So I didn't put together a formal agenda. I just thought we could just kind of talk and share today. But would love to do a round of introductions if that is okay. So can share your name, pronouns, where you're coming from, your role, and then I guess particularly for tribal partners joining today, would love to know a little bit about why you decided to join today's call, and if there's anything specific that you want to learn about or talk about or share out, it would be great to know that. So if we haven't met, I'm Christy Hudson. I think we've emailed before, but she, her pronouns. I've been kind of primary contract administrator on the 21 to 23 System of Care grants. So been really appreciative of all the incredible work that you have been doing with those funds. What else can I tell you? Transformation manager with the System of Care Advisory Council, and just really excited to talk a little bit about the next round of funding and hear your thoughts about how you want to use those dollars. And I will pass it to Joylene.
Hi, everybody. Good morning. My name is Joylene Carter. I use she, her pronouns. I am the new Youth and Family Engagement Coordinator with the System of Care Advisory Council. I'm about 3 weeks onto the job, loving it so far, really excited to get to meet you all. And for our little team, I will pass it to Anna.
Thanks, Joylene. Anna Williams, Director of System of Care Advisory Council, she, her pronouns. I'm here to understand how we can continue to share information and support our 9 federally recognized tribes, the 9 federally recognized tribes, and continuing to build system of care work and where we should be directing that support so it's most effective. And I will pass it to Zenaida. Oh no, your audio is not working. We can't hear you. How about Carly? And Zenaida, you can work on your audio.
I'm Carly Boren, she, her, and I am the grant writer, grant compliance coordinator for Klamath Tribal Health and Family Services in Klamath Falls. I joined today because we currently have a System of Care grant that we are creating an outdoor cultural space at behind one of our buildings in Chiloquin. And construction is a little bit more than we had originally anticipated. So I'm excited to see what future opportunities there are so we can help finish that project. I don't know who has not gone yet. Sorry, somebody want to go?
I'll go. Michelle Moore, I'm the Social Services Director at Cow Creek Band of Umpqua Tribe of Indians. And initially we had applied for this grant. Christy, you and I think were on the phone quite a bit at the beginning. And then what we decided to use the previous funding for was to create a cultural center where our youth and elders and where we could hold events. And so we basically used that to create the plans for that. And so Jason Robeson, I don't know if he's been attending these or not, but he kicked it back over to me now that that round is done to figure out if there are other projects that we might be able to utilize future funding for. I kicked it to him, he kicked for, it's been to culture, it had to go because our SOC funds usually come through our child welfare program, as you know. And so this was a little bit different and actually a welcomed opportunity because it let us step a little bit outside of what our System of Care funds are utilized for, which is, mostly prevention and services for family. So anyway, I'm back until we figure out who it might go to next.
Yeah. That's great, Michelle. Thank you so much. And yeah, I think that's one of the things that we've been most excited about, impressed about, is just how much creativity and innovation happen with these dollars. So would love to continue to support that. Let's see. Denise, do you want to go next?
Sure. Good morning. Thanks for having us this morning. I'm Denise Sulzbach, she, her pronouns, and Michelle, my middle name at birth was Michelle, also spelt with one L. So kudos to us and those who named us. It's very unusual. I am the director of the TA network within Innovations Institute, and Kim's going to talk a little bit more about the work that we do. And probably relevant for you all to know is from 2013 to 2020, we were the Technical Assistance Center for SAMHSA for all federal System of Care grants. And through that work, we had several tribal grantees each year. And we partnered with NCWA in the direct technical assistance for our tribal nations that were part of System of Care grantee groups. So I oversaw that work in partnership with NCWA, who provided the direct technical assistance. So we're excited to be here today, learn from you, and hopefully engage in some partnerships moving forward. We'll go with Kim.
Good morning. I'm Kim Estep. I'm also with the Innovations Institute at UConn, obviously. Denise is my partner in a lot of things that we do there. And I oversee system design, implementation strategies at Innovations, in addition to a few other hats related to wraparound and some of the other models or behavioral health models, child serving models that we disseminate around the country. And so we have wraparound, which I feel like you all are probably familiar with, as well as an intermediate care coordination model, peer parent support, as well as mobile response and stabilization. And so we are very excited to be part of this today. We have really enjoyed our partnership with Oregon, and it's been short, but I mean, really, honestly, at least for me, it's been short in timing. I think it just started last July, if and it hasn't been very long. But we've really enjoyed getting to know your state and getting to know all of the facets of Oregon, which has been fun. So I just want to thank you all for letting us now join this to hear from you all, which we're excited about. And pronouns she, her. Johanna, I don't know if any
I'll hop
speaker.
in as as the other UConn person. Hi everyone. My name is Johanna, she, her pronouns. I work at the Innovations Institute at UConn with Denise and Kim, and live in Oregon, Iowa, for those of you that were a part of that conversation. I'm pretty new to the UConn team, and my primary focus has been learning about Oregon System of Care and helping think about how we can increase the infrastructure and operationalization of System of Care, so the work that we do makes good things happen for children, youth, and families in our community. Although I'm new to the UConn team, I'm not new to System of Care. So my experience in System of Care started as my own participation as a youth member on our System of Care Governance Council in a 5-county Northeast Iowa, very rural community. And then it turned into a career pathway I didn't know was going to exist. So I spent the last dozen years or so primarily helping uplift and empower young people with lived experience to engage as thought partners and designers in how we can improve systems and communities of support. Excited to be with you all. I've primarily in Oregon been working in local communities and been really focused on what does System of Care look like at the community level. And so excited to hear particularly how grant funds have been used and might be used in the future. Thanks all.
TJ, looks like you've joined us. We're just doing introductions. Do you want to say a quick hello and hi?
Yeah, good morning, I guess I should say. TJ Foltz, Confederated Tribes of Warm Springs. I just seen this on Caroline's actual calendar to be on, and so usually if she can't be on, I get on to see what's going on. I'm just trying to figure out, or I guess listen into what systems of care this is. Is this is the one that I was doing or the one that she has, because there's, a little bit separate. So if this is the one that I was doing, and I know these new monies are coming in, that's something that I'm really interested to see what and where, because I already have plans for those monies, knowing that I spent the other money already, and I'm working to finish that report. I think that's due in a couple of days. So I'm just trying to do a visual one more than a typing report. So yeah, I seen it on there. I don't know why I'm not on the list to be, like I haven't been on one of these calls for a while, it seems like. So I know they usually have monthly meetings. So again, I'm just here to kind of listen and see what's going on. So yeah, I'm still working on the visual thing. I do have a ton of pictures. I'm like new to the Mac world, so I'm trying to figure out how to do my iMovie or something of that nature. So it might be a combination of both. So we'll see. But yeah, so I'm just kind of here to listen in and see what's happening. So
Great. Thank you so much, TJ. Zenadale? I'm saying your name wrong. Is your audio still? Yeah, we still can't hear you. I'm sorry.
Sometimes if you log off and log back on, I've noticed sometimes there's a glitch. It's happened to me before. You might want to try to log off and log back on, and then sometimes all of a sudden your audio works. Christy, I had a quick question if we're done with the introductions, or not a question actually, but I guess and TJ kind of brought it up a little bit, the difference in the SOC funds, because we have SOC funds through ODHS, and then we have system of care funds through Oregon Health Authority, and they're both with the same, goal of preventing foster care and helping families and those kinds of things. And so I'm just maybe a quick explanation on that, because for tribes, at least for us, and we've noticed some of these overlaps, and then we're having to work with our clinic, because some of the homelessness funding now that's going into the clinic, really we're doing the homelessness stuff. So it actually has kind of not forced, because we always work together, but more collaboration on how to utilize these funds internally. And so I guess for the system of care discussion, maybe you can explain, like, how did OHA, have system of care dollars for what is really kind of an ODHS child welfare sort of a thing. My thought is to reach the people that aren't involved, right? The other population. But for tribes, and we talked about this at the directors meeting last week a little bit, about how it's becoming somewhat complicated for us, because now we're having to sit down and figure out who's doing homelessness. Is it our clinic or our behavioral health now? Is it us? And how do we coordinate that? And we've gotten really good at that, don't get me wrong, but maybe just a little explanation on what the difference is, I guess, between the two entities providing some of the same funding.
Christy, do you want me to hop in here? Thank you so much, Michelle. So, Christy and I joined the system of care space a year and a couple months ago, right? And we weren't even aware that those DHS system of care grant funds existed until actually the tribes were like, we get money from DHS for system of care and OHA for system of care. And at one point there was a conversation, I believe it was when Christy went to the Oregon ICWA conference, where people had said, could you combine those funds? Does it make sense to combine those funds? Can you look into that? So we went and had a conversation with DHS and Adam Vicente and his team, and then also with Julie Johnson at OHA, who's the tribal liaison over there, and kind of tried to figure out, can we just amend the money that OHA has for system of care into the DHS system of care grants? Like, what we're looking for is, how do we reduce just administrative burden and maintain the opportunity for impact and flexibility? The reason why, like, how that happened was just the way that the original bill was written. Senate Bill 1 in 2019 said, here's money for OHA to do system of care work, and ODHS, you also have to do system of care work. but it was two separate funding streams. DHS is spending like some of their own internal money on system of care work, and then OHA gets a second sort of allocation for that system of care work. So that's why there's like two funding streams. But they, like, as I'm sure you've noticed, Michelle, the way that they're defined is very, very similar, because they actually were using that same 2019 Senate Bill 1 language to say, okay, these are the goals of the funding because it's attached to this bill, so you all need to be doing these things. The point where it differs is that OHA's funds, to your point, Michelle, that you already made, are more flexible, right? So the DHS funds are really focused on that child welfare population, and then the OHA funds can be focused on, I mean, you can spend them on that same child welfare population, and you can spend them on prevention, you can spend them on cultural engagement, that's just a much more broad sort of, what do the tribes think is going to be best for children and families, and building as a strong system to prevent engagement with any kind of restrictive service, right? Like a child welfare service. So, you know, we're very interested in conversation around, is it good to have the child welfare focused funds and then this more flexible opportunity to do what works better? Is it more burden than benefit? How do we work together with you all to make sure that the funds are coming to you in a way that are most effective? And that may be tribe by tribe. What works best in one community may work differently in another community. So it may get more complicated on our end, but the point is, how do we support you all in doing what it is that you feel like this money can best do for your tribe? Does that kind of answer the question, or is that just like a bunch of speaking?
No, that's really good to have that history of how we kind of got here, because we had to try and figure out, like, so because they were OHA, then they came through Sharon through our clinic. And then also ODHS provided us the information. So I got with Sharon Stanfield and I said, hey, should we apply? Should you apply? We decided we would apply. And then when we have a committee here, when we apply for grants we need to know, we have to have approval or have a project or a plan to spend those funds before we apply. And so I just sort of reached out to house, all of our internal executive team. And so then we decided on what our project was. And then they ended up over at Jason's, although we all still participated in our own systems meetings here, because there was a lot of participation by, so really what happened for us with the OHA, the social services, we have a pretty defined role, right? I mean, we serve the membership. So what it really did was it kind of opened up a new level of conversations and planning around the membership with natural resources, right? Because they're timber and, we get our camping passes from them. But as far as like, they were the ones that kind of took this on. So that's what I'm interested to see, is these new monies. And I think it's good to have them now that we've sort of figured out what's going on here internally, especially our accounting office is like, why do we have this SOC grant and this SOC grant? Why does Jason have it? So now I think we have a pretty good process in place. And given that the funds through you guys are a little more flexible, for more of a, not so much service driven, but like the cultural centers and those, being able to do some of those funds for spaces and other needs to be able to support the SOC funding, the prevention funding through. Did that make sense? I don't know, but
that makes perfect sense. Like that I think is the ideal, right, Michelle? And like, I love to hear it. And I love to hear, one of the things that I just wish that we could figure out, and maybe you can help us with this, the way that our conversations with tribes go around the creativity and service integration and systems sharing, and like, that's what I want to see the regional systems of care through the CCOs doing, right? Like you all are doing this level of cross-system collaboration within your tribes that is like what system of care can really be for folks outside of the tribal space. And so I'm just always so like, yes, Michelle, that's exactly how we wanted it to play out. And so I just, I don't know, Yukon, if you can just kind of put a little marker on that of like, this is one of the things I would love to see how our local systems can learn from what our tribes are doing well.
Well, and I will tell you with our system, so really this brought us together internally, this project through this system of care, because it involved natural resources. They're sort of their own thing, right? And it sort of, we worked together on lots of projects, but it really sort of created a connection with our other system, with all of our grants here anyway, with Cow Creek. We have our community. I mean, we are so involved in the community. We sit on many different boards and committees, and I've been appointed. They created a space on our Roseburg City Council Homelessness Commission for the tribe to sit on. And so we are really, especially right now, looking at what we may have coming in the future, 25, 27, potential recession, cutbacks, where I think we're already seeing those now. COVID, we had tons of money.
Yeah.
And so we in 2023 and then through we've really made these connections with our community. And we have MOUs and agreements, and we're leasing modular homes for our transitional housing from a low NeighborWorks Umpqua. We're with ADAPT is providing us with mobile crisis unit and all these other things that, sobering center and detox, that we don't have the capacity to have those ourselves. We wouldn't utilize it as much, right? But our connections
when you need it.
Right. So when we call ADAPT, they, mobile crisis units dispatched immediately without any question. We pass some funds through them. We're going to have 2 or 3 beds at the hospital. So we're doing a lot of system of care stuff in the community. What I really liked about this was we really got almost every entity in the government office together on this project. So this project brought us kind of really together. So that's and then Jason was kind of like, well, we're kind of done with this. And I said, I'll get on there and see if there's something else we might be able to utilize. So anyway, I don't want to take up too much time because I know you guys, but I am curious to know if TJ, if this is the grant that you had or the one Caroline had, now that they've explained it.
I'm sorry, can you repeat that? I'm doing something else right now, and I heard you say my name, and I just didn't want to miss out.
So Michelle, you went back on mute. I don't think he can hear you.
I was just asking if you figured out if this was the grant that you had or that Caroline had.
So again, yeah, I think that this is the one that I have. I'm pretty sure. So
yeah, it is.
It's the $200,000, right? That was 100 one year and 100 the next year, if I'm correct.
You are correct.
Yes. So yes, then I know I'm in the right spot, but I do understand that's kind of where I get confused is because we're the Health and Human Services branch, behavioral health is underneath us. And I swear that I hear SOC from somewhere else. And I have to constantly ask Caroline, is that my SOC or somebody else's SOC? So making sure that, the systems of care, whichever one it is, because honestly, I'm involved in almost everything she's doing as the person who's, I'm supposed to be her successor. So again, I've probably, if I was to be told what the other one was or reminded, I would probably be able to elaborate more, but I know exactly what happened with this SOC grant because I did most of the footwork for it. So.
Okay, great. And we can work on clarifying that, not in this meeting, but we'll continue to work on that. And Suneda, it looks like your audio is working. Do you want to just introduce yourself quickly? Go ahead and unmute. Let me see if I can do it for you. Oh, I cannot do it for you. Oh, you can't unmute. Okay. Well, we're glad you're here. Feel free to type any of your questions into the chat if you have them. Thank you.
All right. So you mentioned interest in additional funding, which is great. So the System of Care Advisory Council, with the funds that we get through OHA, the council allocated $1.8 million to the tribes. We brought that question to, I think it was the Behavioral Health Directors meeting, Anna, last fall about, do you want to use a straight $200 to every tribe? Is there some other funding formula that you all want to use? They said, no, let's just continue the 200 to each tribe. So we have another $200,000 from the 23 to 25 biennium, no changes in kind of purpose, still very flexible. So ideally, we're going to try to do this via an amendment to your existing grant agreements. That being said, I think there are 2 or 3 tribes where the grant agreement has already ended. I don't know off the top of my head if that would be any of you, but in those cases, we'll work it out on our end, and whether it's not, maybe we need to do a reinstatement or we just need a new grant agreement, but we'll work it out. But regardless, so we're just going to try to make this as easy as possible. And what that means is we just need kind of a description, doesn't have to be long, can just be in an email of what you want to do with another $200,000, assuming you want the full amount. And then we'll take it from there. So we just need to get enough content for a scope of work together, and then we will take care of the work on our end to get that money out to you. So I think most of you are now ending by June 30th. So if we're going to amend, it'd be great to get those amendments started sooner rather than later. And I know some of those things can take longer than we all imagine or hope they would. So
if to set a timeline, like we'd start getting into crunch time if we don't have that kind of just narrative description of how you intend to spend the money any later than the beginning of May. So like if you want to put something in your calendar, like get this to SOC by May 1st, that would be sort of last minute, but anytime prior to that is also very welcome. And TJ, I see your hand up.
Yeah, thank you. Again, so if I'm hearing correct, as long as we send an email kind of giving you a generalization of what we plan to do with this other 200,000, again, that's totally possible for us. We'll probably even have a little bit more of a breakdown, because like I said, we've been kind of anticipating this money coming in. We've done a lot of work here on the reservation to help change the landscape almost, so to speak, as far as helping families and being able to provide spaces for people to utilize to be a healthier family, all the way from, little children to elders. So I guess one of my questions I have is, do we have a timeline or a time frame of when this $200,000 will be dispersed again? So when I go back to Caroline later today, I can say, hey, these guys, because I don't know, I don't, obviously she's probably not on this call, or else she would have chimed in by now. But, I just want to be able to say, hey, I was on the systems of care thing today, we knew we anticipated this money potentially coming in again. And again, for me, I just want to be able to say, hey, they want us to send them an email by this time, and then hopefully we'll get the money by this time. So.
Yeah, I think we could distribute the money as soon as we got the grant agreement executed. That can take a couple of months depending on, some back and forth and signatures and stuff. Regarding the disbursement, I know that was a challenge because the way the initial grant was set up required you to invoice, and then there were 2 different installments. And I'm not convinced we need to do that again this time around. But that's some questions we can ask OHA about, once it's all signed, can we just, pass you all the money and be done with it?
And then, as far as signing goes, so if we haven't, our current one hasn't expired and we just do an amendment, right? That just doing that amendment and then being able to sign that amendment saying it was done, then that should all it should take, or?
Yeah.
Okay.
Yeah.
And then to the point about the invoicing, if you all have a preferred, we'd like to just get this 200 up front as soon as the amendment is signed, that would be great, TJ, to just let us know so that we can say, this is what they've asked for and this is how we're going to try to pursue it.
Yeah.
If we can't do it, obviously we'll let you know, because DOJ has opinions.
Okay.
But
I mean,
knowing
yeah,
what would
I
work
think
best for you gives us some direction to take to
Yeah, I
OHA.
think-
This is how we want to go forward.
Yeah, I
Sorry,
think no, that's okay. I think we would probably, again, we would prefer, to be able to just have it and then, have it somewhere where we can, I don't want to say draw down, but as we expend through that, we'd be able to just say, okay, we have the 200,000 in the SOC grant. I want to spend 50 on this, 40 on this, and and I have to keep invoicing, but be able to just have it and internally be able to work that. And then, you guys would be able to see that, however mechanism that is, I'm not a
Yeah, just
finance
via the
guru,
report,
so
right?
yeah. So I mean, just being able
that would
to,
be great.
yeah, I think that would be ideal for us, because like I said, we have a lot of, we've used a lot of other monies for other things that we've done here on the reservation, and we're just trying to find some ways. Like for instance, we built a giant, what we're calling a pavilion. It's a 80 by 140 foot long, 80 foot wide by 140 foot long pole structure building that we put here right on our campus area near our Health and Human Services branch. And then we added some turf underneath, for an area for families and for the community to be able to utilize. And so there's other stuff that needs to be done in that area. So we were kind of hoping to use some of this money to kind of fill in some gaps there that, we're trying to, we're building a building that has 4 ADA restrooms and a little area for people, like if they have a community event there, and we want to have like a concession stand and some other stuff. So we're trying to just make sure that we, fill some gaps where we need to. So I think anticipating these dollars is one of the ways, or one of the avenues we were hoping to be able to address some of that. So, I mean, again, it'll be easier for us, I think, if we get that amendment done. And then, like you're saying, if it's possible, just maybe being able to send it all at once, and rather than us having to be to invoice you guys. I mean, that's just my opinion. Caroline may say something completely different, but that's my
Well, you
opinion
can let us know
anyway.
when
So
you send in the, you and Caroline can talk, and then if she says something completely different, we'll take your email very seriously, TJ.
yeah, so I will make sure that hopefully I'll get with her later today and we can chat about this, because I don't think for us anyway, like I said, we've already got, kind of plans and knowing what we're going to do with what. So hopefully we'll be able to put this 200,000 again to good use for the betterment of our community. So
Perfect. Looking forward to it. Thank you so much.
All right. Any other questions about the grants? I want to make sure we've got a little bit of time to talk about the technical assistance too. But if there's anything else, Carly, Michelle.
Did you say May 1st? We needed to notify you by what was the date?
Yeah, I mean, like latest timeline, just to make sure we have enough time to get it out to you before the contracts are ending.
Okay. Sooner
means money sooner too. So
yeah, and it might be a little bit different for those who have already ended their grant. So I'll send out an email to everybody with the recording of this, and then you can follow up with me if you have any questions.
Okay.
And oh my gosh, I'm having a hard time with my mute button. Christy, maybe you can look at those grant agreements and let the folks who are expired know differently.
Yep.
Okay, perfect. All right, technical assistance opportunities from the Innovations Institute.
Yeah. So just to kind of give a sense though of there's a lot happening in Oregon. There's a lot of information being collected. There's a lot of conversation happening around needed changes to support young people and their families in their communities and their homes and so on. And we've had a chance, I think you've heard, I mean, even with Johanna and Denise and I, to talk to a lot of different groups. We've talked to family organizations, we've talked to locals. The locals include providers, CCOs, family members, so on. And then of course, partnering with the state and the SOCAC members and so on. And nationally, we have partnered with tribes in a couple of different ways. And this is not by any means limiting the conversation that we want to have today, but we have partnered with tribal colleges around the installation of some of the training models for workforce development, particularly around care coordination, as well as working with providers around the installation of evidence-based practices or evidence-informed practices around, kind of boosting their work and partnership and coordination of care with tribal nations. And so we wanted to take this opportunity to make sure that your voices were also elevated in this process, and that you were contributing to, what are the needs in the community. Particularly our technical assistance has centered on behavioral health needs. And I think that oftentimes a lot of the creative things that you all are talking about get dismissed, but the importance of those, and I'm not saying that it does in Oregon, I'm just saying in, some places, that they don't have an eye toward, or an ear maybe toward the needs of communities and what that looks like, and that it's not necessarily building out of the service array, although that is certainly an important component. And so we just wanted to hear from you all today around what kinds of behavioral health support or needs are in the community, if you are familiar with that or could speak to that a little bit. And then what might be helpful from a technical assistance perspective, for your communities related to behavioral health needs, and really just the success of families, young people, children, caregivers, and so on. Did you want to add anything, Denise or Johan?
No, I just really want to hear from
Mm-hmm.
partners in the call.
So when you say technical assistance, I think helping us with IT stuff or reporting or those kinds of things.
Oh, yes.
So
Yes.
I'm kind of like,
Yes.
it's like a twofold question. So
Yes. I too, when I first heard the word technical assistance, that's what I thought too, because we have the IT support at campus, which is about technical assistance, but it's really just consultation, support,
okay.
Helping think through, needs for families and young people. And that technical assistance or consultation or subject matter expertise or connection, or just making sure that your voices are included as part of the work that we're doing for Oregon is really what we're talking about. It's not actually related to IT at all.
Okay.
Or
Because
any
that's
So just like
those
an example is
components.
that we're trying to work on with this team is it's called like a care pathways analysis. So it's looking at when do people get into services? Where do they go once they kind of come through that behavioral health service door? Do they get the service need met, or do they end up bouncing around within our sort of system? How can we make it more efficient? Like looking for what they call kind of interruption points of oh, this person got involved in child welfare, they ended up involved in the justice system. That's not what we want to see happen. So where along this pathway of the services we have, could we have hoped to engage them sooner so we could prevent any kind of negative system involvement by giving them the resources and supports they needed sooner? So what might that look like within sort of your tribal system? They can kind of sit with you and talk through how do people currently move through that service path, and how do we want them to move through the service path, and how do we get our reality to look more closely to that ideal pathway? If that's a helpful, that's sort of one of the things that they could do with you.
Okay, so in a nutshell, because it's way more, it's a labyrinth, but basically we have an internal MDT, multidisciplinary team that is made up of all of our social services folks, self-sufficiency, our child welfare, all of our programs here in social services, as well as behavioral health, a representative from the clinic, housing, education, workforce development. Sure, I'm forgetting a few. And so then we members sign releases of information so that if 2 or more departments are working with a person, we are staffing them because housing may become an issue. So we have a long list of members that we staff weekly, and we are ensuring that we're wrapping services around. And that's basically, so our first, we may get a call from the clinic, hey, I have an elder here, that we may not have been tracking because we usually are tracking pretty much everyone that's ever been involved in child welfare. We don't ever really close a case here. It's sort of like this open-ended, and then we're checking in and, you know, and then with behavioral health, our big connection there is that our self-sufficiency and child welfare workers work very closely with our behavioral health people and our transportation. We have tribal transportation, and so we can transport people. We are transporting some people daily to behavioral health to keep them clean, or you know, to monitor them. We have, the tribes provided a few apartments, and we're working on like an Oxford style house. We have transitional housing, but what we found was putting people in out of treatment with people who have been in recovery for a longer period of time was not working out. We were having, you know, massive relapses in our little 6-unit area. So they had to do 6 months at an Oxford house locally. So we have that connection that our behavioral health has. Our behavioral health also has the connection with all of the treatment centers. So we're always, you know, we're doing case planning. Our transitional housing, where we're able to reunify families faster because it's weekly case managed. They have to meet weekly with their case manager, go over, and they're on a weekly lease. So in order to update their lease, we found that you know, doing a regular lease was not working because people would, you know, but in order for them to extend their lease for the next week, right, they have to do their case plan and be successful, then we are seeing more success for transitional housing. And then the other thing that we implemented to be able to return kids faster is a sweat patch drug testing. And our behavioral health is actually also, and we got this idea from Minnesota. We had a case in Minnesota with a tribal family there. And in Minnesota, they use these sweat patches that people can wear for 7 to 10 days, which tests their sweat during that time. And so in order to go into transitional housing for the first month, they have to wear that at least for the first month. And then randomly, we might just decide to patch everybody in transitional housing. So we have had a huge success in that area because UAs, you know, sometimes people, but the sweat patches have been very successful. But anyways, we've developed, well, I don't know if you guys know, but I used to work at DHS Child Welfare here in Douglas County for over 20 years. And I was the ICWA, and so the tribe, you know, so I've kind of structured our social services like DHS government, but with our tribal, with what works for the tribe, because we're much smaller, right? And so anyway, that's how we figure out who we need to work with. And families now are very comfortable. They know we're here to help. They will call us and they'll say, you need to get out to, you know, my daughter's home. I'm very concerned, and we'll go and offer services. If housing's having problems with people in housing before they do any evictions, they're calling social services. We're going out. We're trying to remediate so that they don't end up evicted and homeless. So that's how we've set it up here, is an internal MDT where we all can wrap the services around and be updated on what people are where they're at. So
excellent. Okay. So, I mean, so that doesn't sound like something that your tribe needs, but other tribes might be interested in some discussion with the Yukon team about how to create something. And I mean, maybe they're not, maybe they want to just call you, Michelle, and be like, how did you, and how can we replicate something similar in our tribe? And then you could say yes or no. So Nate, I see your hand up, and I also see that you put a question in the chat. Just want to make a little bit of space for question to Kim that's in the chat.
Just so your speaker, it's still, you can't unmute yourself. Okay. I just didn't want to know. I didn't want to make that assumption if it had magically like fixed itself. Yes, technical assistance around workforce development. I mean, we're open to the conversation. And so I think that you asked about assistance to drum up your recruitment for tribal members to take advantage of the workforce development opportunity. And I think we would, I mean, that is really cool. Unmanned aerospace system. Can I do that? No, I'm kidding. Nobody wants me to do that, but it sounds really fascinating. But that might be something that we could, those kinds of conversations are absolutely things that we can make available to you, and hearing, what are the needs in your community and how can we support that? And we're happy to have an in-depth conversation. I know we only have like 10 minutes left on here, but if we want to, if you would like, we can schedule a separate time and talk more about the grant and the workforce needs that you have at the college, if that's okay. Is that okay? Okay.
Yeah, looks like that's a yes. I love this.
Yeah.
I think it's really cool because again, the way that the systems are more integrated within tribes, there's just so fewer silos, right? So when we're thinking about drone pilots and how does that relate to system of care, right? Like these are folks who are parents of children, these are folks who are caregivers in their community, right? Finding stable employment that provides a meaningful wage for folks is part of system of care, right? So
absolutely,
that's why I love these kinds of conversations.
It is exciting. I agree with you, Anna. Like it creates lots of opportunity and builds relationships, and that's really all that we're looking for. How do we build relationships to support one another, and then build opportunities so that people can do what they want to do in life, and hopefully some of them will want to be unmanned aerospace system drone licensed pilots, which is very cool. Could you pop your email address into the chat, and then we could grab it, because I'm not sure if I can get it from the meeting invitation, but just in case, I don't want to lose it. So if you could pop that in there, we could just grab it from there. Okay. Anybody else? Like we have like 9 minutes left.
If no one else has questions or suggestions for us, Michelle, I'm wondering also if you want to share, if you're interested in sharing more about, so in addition to supporting Oregon Health Authority, SOCAC, the local councils, the CCOs, and helping ensure that families have access to the right services at the right time, part of what we're also doing is helping using the system reform support instrument. There was an attachment that Christy sent to all of you, and it's probably looked like Greek in not understanding the context, but we made an attempt to then translate that tool to tribal use. The purpose of that tool is to help identify those system structures, those pieces, whether it be communication, responsibility, translation between the tribes and the local SOC councils, the CCOs and the state. What are those system structure pieces that need to be looked at in order for you to be able to have that creativity and provide those services and supports to the families in your tribal community? So do you have anything further on that?
Well, you actually read my mind.
Wow, it's because we both are named Michelle. That's it.
that must be it. Because in talking about, the workforce development stuff, is that where we might, internally, we're always growing, learning. I think just listening to what everyone else is doing helps us too. But that was kind of what was going through my mind was, what about those connections between the DHS and the local SOC, and how coordinating, those efforts with our local CCOs and that kind of thing, because this is an OHA and that's not really my realm. My realm's more ODHS. Those connections are there. So you kind of read that you read my mind on that one, because that's all of a sudden what started going through is, what about not internally, but with our external partners?
Yeah. And so your prior work with child welfare and how you brought that in and adapted and translated for the tribal communities also sits you sit in a important seat in that regard because you bring both sets of expertise to the table. I'm actually wondering if there would be interest in looking. So we have conducted, Johanna has conducted, by we mean Johanna, the SRSI with 8 local system of care councils. And I'm wondering if there would be an opportunity for us to share collectively what we're hearing from the local councils, and to what extent do some of those needs resonate with your work with the tribal communities and as members of tribal communities, and if there would be interest in anyone on this phone call doing that. Thank you, Christy. Appreciate it. And if not, that's fine too.
No, I would be interested because I know at least on our ODHS side, and sometimes I attend the 770. I haven't in quite a while, but sometimes there's overlap. But I know DHS is, you know, they're really looking at what tribes are doing in prevention and keeping children out of foster care and, you know, suicide prevention and the substance abuse. And NAR just did, you know, they kind of changed their thing around tobacco from, instead of cessation of tobacco is sacred, right? And it's a sacred thing.
Yep.
We don't, you know, so those kinds of things. And so I know DHS, you know, at least has been saying for many years, but has started to move in the direction of really listening to tribes of what are we doing that's working? Because, you know, right now we have 4 children in foster care across the whole United States. When I got here, there were a whole lot more, but, you know, we also have to work with our members outside of the state. If we get a call from members outside of the state, and that's one of the things we love about the SOC funds for child welfare is we can use those for our families involved with child welfare outside of the state, much like the ICPC process. And so that's really helped us. So, you know, we're on the phone finding resources for families in their area, like the, you know, nonprofits that provide homelessness prevention. So not only are we doing this in the state of Oregon, but we are doing the best that we can also in other states. So yeah, any kind of assistance on that as far as SOC, you know, other counties like Douglas County, I worked there. So I have a lot of relationships here in the community. So it's really actually easy to get all of these things going and started. We find that when we get out into other counties, and I know other tribes, probably the same thing, where you don't have that local relationship, that's where we start running into those barriers of working with community in other counties.
Very relationship based is your work, which is really the essence of system of care too. So that's great. Thank you, Michelle.
Well, and just real quick, the CCOs, you know, are they regional or county based? But tribes are not. We are not. We have members all over. So we have to work with all these different entities that are doing things differently. Yes. Anyway, I'll stop with that. But any assistance there would be great.
I don't know if that's another sort of, you know, we UConn offered to kind of schedule a one-on-one in more in-depth conversation with Zenaida. I don't know if that's a similar opportunity for Michelle too, to kind of think about what are the strategy, you know, like a little technical assistance package or conversation around strategies for engaging with systems outside of the ones you have relationships with, and what does that look like, or how can they build capacity in that space? And I know that is something, at least in my conversations through the Oregon ICWA team, I mean, it's a mandate, right? That any tribal member who might be involved in child welfare needs to be provided culturally specific services. And then there are some Oregon state laws that get in the way of that sometimes. So DHS, for instance, won't pay for an out-of-state placement for a tribal child, even if the proper placement is in another state. And so I don't know, Michelle, maybe that's where some of those more flexible dollars come into play, that the tribe wants to assume responsibility for paying for that, they can do so, but they can't use state funds or Medicaid funds, like DHS funds, right, to pay for that. So I don't know if that would be kind of a technical conversation as well, but those are some, I think, repeating challenges that multiple tribal partners have named in conversations with me around that sort of systems navigation
Mhm.
barrier. I don't, Michelle, gonna put your email and phone number in the chat as well, so they can reach out and schedule a time.
Okay, great, thank you. And to your point, Anna, there's a lot of value in what we can learn from this group, as well as what the other local system of care councils could learn about the relationship building and the ways to make systems work on behalf of children and families. So yeah, I'm excited about this. Thank you. Thanks, Michelle.
All right, I recognize we are close to time and want to be mindful and respectful of that. So thank you so much, everybody, for joining in. Denise and Kim, sounds like you've got some folks to follow up with. And if there's like, you know, something you want to summarize in an email that we can send out to folks who weren't here with the recording, happy to do that and put you in connection with folks who weren't here today.
And Carly, if you know, I know you're grants manager and not really a service delivery. You know, if you take this back to somebody and have a conversation and an idea sparks, you are welcome and encouraged to also say like, hey, you know, we might want to engage on this topic, right? Like it doesn't have to come from you, Carly. Just make awesome. Thanks. And TJ, same for you and Carolyn and whoever else on your team might want to say, you know, we'd want to hop into this conversation with Michelle or a workforce conversation or something else too.
I would love to hop into the workforce conversations.
Right.
Oh, great. I
Christy,
saw
would you-
that Joylene put in the chat around the ICPC and what, I didn't see a response to that, but that might just be me.
Is that
But
what it
she
stands
was
for, Michelle?
asking,
Interstate Compact on the Placement of Children.
Yes, so we originally were only able to use our ODHS state funds inside the state. And then I said, well, you use them outside of states when you place children outside of states. And so it expanded our ability to use those funds outside of just the state area. But Christy, really quick, because I know we're on time, up against time. Will you add me to the next invites, please? And then take Jason off because until we figure out what we are going to possibly use these funds for, it'll be me attending these then.
Yes, she said, but she's muted. All right, I know the person in my 10 a.m. is sitting over there, so I'm gonna hop out. Thank you all so much. It's great.
thank you.
Thank you. Thanks for having us.
Thank you. so much.
Thank you.
Bye,
Thank
everybody.
you. Bye.
Bye.